data this year on lymph nodes and sentinel lymph nodes, and essentially consolidating the data that once you have examined the sentinel lymph node, you have a fairly decent idea of what's going on in the axilla, and we don't need to do complete axillary dissection for a vast majority of patients, even in patients with neoadjuvant chemotherapy. So that was from the surgical angle, a wonderful news. There were several other presentations talking about newer agents. One of the most exciting agent was an oral SERD, which the lidERA trial, which basically showed that this fulvestrant type drug, which can be given orally, had excellent activity in the adjuvant setting. So there were several very nice presentations that were present or data that was presented at the San Antonio meeting this year.